Okay, I'm back. Another one that's controversial. I forget the common name for it, but can be taken within the first 7 weeks of pregnancy, and it induces a miscarriage. A miscarriage is a word for if you lose a pregnancy in the first 13 weeks of pregnancy, it's called a miscarriage. After that point, it's referred to as an abortion. You could have a spontaneous abortion where the woman's body just takes over and rids the pregnancy, or an induced abortion. Tubal ligation is when this is a picture of the man's, but this is when the uterine tubes are cut. It's the cutting of the uterine tubes, and you tie off the ends. Vasectomy is where the vas deferens, or the tubes that lead the sperm from the testes to the urethra, are cut and tied off. Tied is the blank there. And lastly, we'll talk about the female sexual response. There are some differences between males and females related to that, but first, they both begin with excitement. The external reproductive organs fill with blood. There's increased secretion of mucus, little constriction of areas and like the vagina, the uterus, and the nipples are erect, and also there's an increase in breathing rate, heart rate, blood pressure during this phase. The next phase is called the orgasm. What's going on physiologically is there's contractions of muscles in the reproductive system. So contraction of the vagina, contraction of the uterus, and it can occur for several seconds. And it causes the brain to induce pleasure, the pleasure response, tension release. After that, it's called the resolution phase. Everything kind of goes back to normal. Blood leaves the tissues. The walls relax. Okay. But a difference here, you can write even down here, a difference between men and women is women don't have a period after this time where they can't get another orgasm like men can. Men usually can't have multiple orgasms back to back. Females can. So that's what that no refractory period means. And I said usually, of course, there's exceptions. So you should be able to answer these questions here. What component of the external genitalia houses urethral opening and vaginal orifice? And what are the effects of prolactin and oxytocin on the female mammary gland?